All right, guys, I wanted to record a quick lecture for you. We covered this, and sorry it took me a week, but I wanted to record real quick just the last class that we had, our last official class last Monday, which was essentially over medical abbreviation, excuse me, and patient positioning. So I'm going to go ahead and share my screen, and we will get going. All right, let's see here. Mm, All right. Okay, here we go. This lecture is going to be super duper short. But I wanted to just take some time and just work through and introduce what we talked about last week. Once again, this is the last official lecture for midterm, and we will. I will also. I'm going to add a couple questions to the final, then I'll open that up. So there is a rule that does not allow me to give the final in class, but I will open that up for you guys ASAP. Hopefully, end of day today, and then you will be able to uh, take that uh, at your leisure. So, okay. So obviously, guys, when we talk about medical abbreviations in patient care, right, the way that we're going to at least talk about this today, or at least introduce it, is by talking about the concept of medical abbreviations um, and patient positioning. So this is really important for you guys because a lot of you, and this is not in any way, shape, or form an exhaustive treatment of this material, but these are the ones that I feel that are the most um, essentially pertinent, particularly because there are abbreviations that you'll see utilized quite a bit and things that we care about quite a bit, particularly if you work with any surgical patients in any capacity in the future. Okay, so clearly, right, one of the reasons why we use abbreviations, um, or well, the reason why we really don't use abbreviation, at least in the vast majority of our medical documentation today, is because all documentation today is readily available to the patient to access, right? Patients have direct access to their medical records, right? And so the documentation that we provide as clinicians um, when documenting a patient visit is actually for the patient, right? It's their documentation and something they should be able to access. Um, so usually, right, we try to write that in patient-friendly language in a way that a patient can actually understand, because those are things that they should be able to essentially utilize um, when communicating with other providers. And there are times, unfortunately, where these types of documents are utilized in litigious situations in a court of law, in the event that there's a lawsuit or something like that. So many times, though, when we have communication between providers, generally that occurs with the use of electronic health records. So, if any of you have worked in a setting where you use an EHR, specifically, Epic is one of the main ones that's most often used. You'll often, you know, communicate with one another from provider to provider utilizing Epic or another health EHR. Um, and so, in some of those situations, though, like with the use of prescriptions and other things, right, there is documentation that you will see that is abbreviated, right? A key example of that is prescriptions, right? Written, when you have a provider that maybe still uses a prescription pad, and may write, for example, gabapentin 300 milligrams, TID, right? Or Q8H, right? So gabapentin 300 milligrams to be taken 3 times a day or every 8 hours, right? And so we typically use abbreviations for the sake of brevity and time, right? But generally, also, they can be an efficient way to communicate between providers. Um, but most of the common abbreviations that we see today are in the context of patient care, particularly prescriptions, and also in the description of diagnoses, right? There are also other abbreviations that are used, you know, uh, as shorthand as kind of shorthand in the exam process. For example, abbreviations like AXO, alert and oriented, right? those types of things. So you'll see all different types of things, abbreviations utilized in patient care. So really quickly, let's talk about medications. Okay. So generally speaking, right, when we talk about medications and when you see these things written out on a prescription pad or in a plan of care, usually these are prescribed with dosage written out, and then also a schedule for dosing, right? So medications obviously that are not scheduled are taken what we call as needed, or with the abbreviation PRN. Okay, PRN means as needed. So when you're either writing or reading a prescription, generally you're going to notice that that medication dosage has the milligrams obviously, followed by a dosing schedule, usually expressed in plain language. Um, but can also be, excuse me, expressed via an abbreviation. So generally speaking, when you see an abbreviation, uh, sometimes two letters, but generally three. They're going to involve a combination of either two to three letters, most of the time three. So generally, you'll see things like Q. So the first, letter Q, it means every. But you might also see B, T, or Q. So B meaning two, T meaning three, right? Generally, so for some reason it capitalized this, but generally these are lowercase. But if you see Q followed by I, that means four. So Q followed by I means four, right? So obviously the I is a measure of frequency, means times per day, right? With D meaning day and N meaning night. So for example, if I say that I want you to take ibuprofen 800 milligrams TID, I've said I want you to take 800 milligrams of ibuprofen 3 times a day, right? Or TIN 3 times a night. Generally speaking, we wouldn't recommend that because ibuprofen is generally dosed at a maximum of 2,400 milligrams in 24 hours, right? So here's a fun table like we use, right, in this class. So generally speaking, if we take a look at these abbreviations, some examples, right? QD daily, right? BID twice per day, TID 3 times per day, QID 4 times per day, right? QN every night, and so on and so forth. You see BIN twice per night, QIN 4 times per night. Other ones that you will see, right? QHS at bedtime, right? Um, so AC before a meal. That there's also PC after a meal, and that's a typo. I apologize. Thought I put PC in there, but I did not. So PC after a meal. Q8H every 8 hours. Q4H every 4 hours, and then you'll see things like DX diagnosis, TX treatment, RX prescription. I think we all know what that is because we've seen that. A lot of our pharmacies, Walgreens, CVS, so on and so forth. And then SX, generally symptoms, sometimes also utilized to mean surgery. Okay, so let's just talk about patient positioning here. So generally speaking, right, when the vast majority of you, right, particularly if you work in a setting where you will be, either working in an office or even working in or around surgery, right, it's extremely important to know these different terms as far as patient positioning, right? So usually in a lot of our office procedures, like a simple office procedure, like maybe you're having a mole removed, or maybe you are having an ingrown toenail removed, right? Usually you're going to be fully awake for that. They may use a local anesthetic, and you're typically either sitting up, you will be prone, which means face down or on your stomach, or supine, right, which is face up or on your back. So usually in surgical procedures, and that's what we have pictured here, right? We're going to put the patient in a variety of positions because the bottom line is we want to gain easy and safe exposure to the surgical site. And so we position the patient in different positions um, based on the surgery that's being performed. So you can see here, for example, a patient that's prone, right at the top. Generally speaking, there are some musculoskeletal procedures that are done prone. Specifically, some back surgeries are done prone. There's obviously also just a modified prone position as well, uh, where the patient's knees are bent, but they remain in prone. Um, Obviously, supine, the one below, right? A lot of our cardiac and thoracic procedures are done with the patient in a supine position. Um, and as we'll see in the next slide, we generally have core positions. So supine face up, prone face down, okay, lateral, which is laying on your side. And there are two different types, lateral decubitus and lateral recumbent. There is the lithotomy position, which I'll show you on the next slide, and then Trendelenburg. Okay, so it's really important to note too that for optimal surgical exposure, you will often see things like bolsters and/or uh, other stabilizing devices used to keep the patient's body stable, generally speaking, and securing the extremities and/or securing the surgical site itself to the table, keeping the patient still. Not only maximizes patient safety during the surgery, but also maximizes the efficiency of the procedure. Right? Not uncommon. So with a lot of the bolsters that get used in surgery, you will see if you ever do an observation. Sometimes patients have a reaction to anesthesia where they will twitch or jerk during surgery. Not anything for you to be alarmed about, but that is a very common thing to see in surgical procedures. So okay, so last slide for this lecture. So different positions. So lithotomy position. You can see here the patient is obviously supine with the legs in stirrups, right? This is a very, very common uh, position for gynecological procedures, also for other colorectal procedures at certain times, right? Just below that, okay, you can see Trendelenburg procedures, which are used for some gastrointestinal procedures as well, and some cardiac procedures. Um, so the lateral position up here, okay, this is the lateral position. You'll often see this used in some neurosurgery settings, particularly craniotomies, brain surgeries, some back surgeries, right? And then down here at the bottom, you have what's called the Fowler position, also known as beach chair, right? And we often utilize this in shoulder surgeries and/or some nasal surgeries, breast reduction surgeries, all these types of things, right? So just a quick view, right, or kind of review of some of these basic positions. So guys, that is it. That's MedTerm. I really hope for those of for those of you that were with us last week, I hope that this class has been somewhat enjoyable for you. I know that maybe this is not the most engaging content, but you guys have been a good class, and I really hope that you've enjoyed your time in the class, and best of luck on the final. And if you need anything in the future, please don't hesitate to reach out. Take care, guys.